Gateway 101 will places emphasis on prevention. We're creating healthcare awareness and we also give you some preventive tips to help you stay healthy. We also have a lot of home remedies that can help you alleviate certain symptoms or certain illnesses. So you need to subscribe to our YouTube channel at Gateway 101 so that you can take advantage of all these preventive measures that we put in place. It is for your healthcare benefit. Please do subscribe and follow us on Gateway 101. So we also create awareness, healthcare awareness in our community because we strongly believe that prevention is better than cure. And we also encourage you to go for your doctor appointments. Do not miss your appointment. Okay? This is very, very important. Never miss your doctor appointment. We also encourage you to make sure you stay up to date with your immunization. Get vaccinated, especially the kids. Make sure their immunization is up to date. We created a healthcare awareness in our community. Without wasting much of your time, we're going to be talking about prostate cancer. It is very becoming too common among men. What can we do? What are the warning signs? And what are the screening method to detect this thing early? So, without wasting much of your time, we're going to be talking about prostate cancer. Prostate cancer is a type of cancer that started in the prostate gland, a small walnut, a small walnut shape. It is a small walnut-shaped gland in men located below the bladder. The prostate helps make fluid that nourishes and transports sperm. Okay, so most prostate cancer grow slowly, but some can grow faster and spread to other parts of the body. Okay, so what happens in prostate cancer? Normally, prostate cells grow and divide in a controlled way. Okay, but in cancer, some cells begin to grow abnormally and uncontrollably, forming a tumor. Over time, it may spread to nearby tissues or to bone and nerve nodes. Okay, do not forget to subscribe to Gateway 101 and the good Lord will bless you. Thank you for subscribing. So, prostate cancer is more common in older men, especially over the age of 50. Men with a family history of prostate cancer, men of African descent or ancestry, they are prone to prostate cancer. Is higher risk and often more aggressive form with men of African descent. Okay. Those with certain genetic mutation can, they are also at risk for prostate cancer. So do not forget to subscribe and like this video and share so that your loved one could benefit from it. Like and share, very important. Okay, what are the common symptoms often accept early? What are the common symptoms of prostate cancer? What? But they are often silent early. So in the early stage, you may not notice it. In the early stage, you might not see it. But these signs are there, but they are just not being noticed. Early signs of prostate cancer. So the early prostate cancer may cause no symptoms at all. Okay, which is why screening matters. Do not forget I will place most emphasis on preventive measure. We always encourage you to go for screening. Schedule an appointment with your healthcare provider and do a thorough screening. Prevention is always better than cure. Okay, so early screening matters. If illness or if alignment is detected early, the cure will be easier. Okay, when symptoms appear, they may include difficulty starting or stopping urination. These are some of the common symptoms of prostate cancer, but often absent early. Okay, so difficulties, if you know you're having difficulties starting or stopping urination, please go for your screening. You have weak urine flow, you want to pee, you want to urinate, your urine very slow, weak, is not flowing normally, it's not flowing out forcefully. These are some of the symptoms, but they are absent early in prostate cancer. So if you're experiencing any of those things, please go for your medical checkup. Prevention is always better than cure. Okay, you have a frequent urination, especially at night. You have frequent urination, especially at night. Go and check yourself up. You will need medical help. Excuse me. You need medical help. If you have blood in your urine or your sperm, if you've seen blood in your sperm, especially in your sperm, blood in your urine might be urinary tract infection, might be a UTI, might be a bacterial infection. But if you're seeing blood in your sperm, these are some serious symptoms. Please go for medical checkup. Okay? Seeing blood in your sperm, you're seeing blood in your urine, please go for medical checkup. Very important. Okay? Then you have a pain in your lower back, hip or pelvic, possible spread. If you are having pain in your lower back or your hip or your pelvis, this is a possible spread of prostate cancer. So you need to go for medical checkup ASAP. If you're having difficulty with your erection, it might be an early sign of prostate cancer. Early having an erectile dysfunction, finding it difficult to have an erection. This might be a possible signs of it might be an early sign of prostate cancer. So go for screening. This symptom can also be caused by a non-cancer condition like a large prostate. Yeah, a large prostate can also cause that too. And so certain medication can also cause erectile dysfunction. So the best way to rule this out is to go for screening. Okay? How is it detected? How is prostate cancer detected? By there's what we call a PSA blood test, also prostate specific antigen is the most common test. You go to a doctor appointment, they will do your PSA or digital rectum exam, GRE, can be done too. MRA scan can also be done too. But to actually confirm cancer, a prostate biopsy have to be done in order to actually confirm that it is cancer. A prostate biopsy have to be done. Treatment option. Treatment depends on the stage and how fast the cancer is growing. Okay, so we just can't overemphasize the importance of checkup. You got to stay on top of your health issue. This is very, very important because if they detect anything early, it takes little or nothing to get it treated. But when it has spread, then it become almost impossible. The one thing I always want people to know is this: there is no duplicate in life. Okay, schedule an appointment to go and see your healthcare provider should be a priority because it all boils down to your life. It's all about life. Okay, so we cannot overemphasize the importance of screening. Go for your checkup. Go for your checkup. Go. You don't have to have symptoms of anything before you schedule an appointment. And it's not just only physicals. Most people only go for their physicals. I'm a physical, that's it. No, you need to do a regular checkup. Mostly if you are becoming older adult. This is very, very important because the earlier anything is detected, the easier it is to get treatment and resolved. Okay, so treatment depends on the stage and how fast the cancer is growing. Active surveillance watching slow growing cancer, surgery, prostate removal. You have a prostate cancer, they might be they might do a surgery to remove the prostate. Okay, radiation therapy might also be done for if cancer is confirmed. Hormonal therapy can also be done if cancer is confirmed. Chemotherapy, this may be in advanced cases. Advanced cases, once you are scheduled for chemo, know that it is in advance. Your kids in advanced cases, the chemotherapy might be prescribed by the oncologist. Targeted or immunotherapy, some cases that might also be an option, depends on what they are looking for or what they want to treat. Okay, so the takeaway here is prostate cancer is common, especially with age, and it is often highly treatable when caught early. Takeaway here. The takeaway here again is prostate cancer is very common, especially with age, and is often highly treatable when caught early. So we're going to go back again and recap. We'll recap again for the sake of those who are joining us. Okay, we said we're talking about healthcare awareness, healthcare awareness, healthcare awareness. Please go for your checkup. Never wait till when you begin to develop symptoms of illness before you run to your doctor. Healthcare, healthcare awareness, medical checkup can never be overemphasized. That's why in our community here, we do provide, Gateway 101 provide free transportation to those people who cannot be able to get transport to get a ride to their doctor appointment. Okay, we provide free transportation for you. It's our little way of helping the community that we serve. Okay, it is free of charge. You can contact us. We'll make an arrangement to get you to your doctor appointment because prevention is always better than cure. You cannot overemphasize the benefit of prevention. Okay, so we create this is why we create this healthcare awareness to the community, and we also do our little part by way of helping. That is our way of saying thank you to the community. It's our little contribution to the community that we live. Okay, so if you are within this area, it needs transportation to go for your doctor appointment, please do not hesitate to contact us. That's all we do. Gateway 101. We put emphasis on prevention because we believe that prevention is better than cure, and we also give you preventive tips that can help you. We also have simple home remedies. We have hundreds of videos of simple home remedies that you can watch on our YouTube channels that will help you elevate some symptoms, elevate some illnesses. Okay, so without wasting much time, we said we are going to recap again. So we were going to recap. So we're going back again to prostate cancer. We said that prostate cancer is a type of cancer that starts in the prostate gland, a small walnut-shaped gland in men located below the bladder. So the prostate helps make fluid that launch and transport sperms. Okay, so I would say that most prostate cancer grows slowly, but some can grow faster and spread to other parts of the body. So what happened in prostate cancer? I would say that what happened in prostate cancer is that normally prostate cells grow and divide in a controlled way. In cancer, some cells begin to grow abnormally and uncontrollably, forming a tumor. It may spread to nearby tissue or bone and the nephron node. So, who is at risk for prostate cancer? Prostate cancer is more common in older men, especially over the age of 50. Men with a family history of prostate cancer, they are also at risk. Men of African ancestry, African descent, they have a higher risk and often more aggressive form of prostate cancer. Okay, people with certain genetic mutation are also likely at risk for prostate cancer. So, and what are the common symptoms of prostate cancer? Often absent early. Common symptoms, but often absent early. I would say that early prostate cancer may cause no symptom, which is why screening matters. Okay, listen again. Let me repeat that again. We are saying that you say early prostate cancer may cause no symptoms. In other words, you might not even have the symptoms. You think all is well all the time, all is well. You never go for a doctor's appointment, you never go for checkup, you never go for screening, and you are older adult. Okay? Because the early prostate cancer may not cause no symptoms, which is why screening matters. When symptoms appear, they may include difficulties starting or stopping urination, weak urine flow, frequent urination, especially at home, at night, I mean to say. Okay, some of the early signs of prostate cancer will be, some of the common symptoms of prostate cancer will be you're having difficult to start urination, you're having a weak urine flow, and frequent urination, especially at night, blood in urine or semen. If you are seeing blood in your semen, in your sperm, your semen, if you're seeing blood in your semen, this is a very, very emergency situation. You need to go for screening. Okay, you need to go for screening. Okay, pain in lower back, hip, or pelvic, possible spread. Okay, possible spread. Okay, difficulty having erection is another common symptoms, but often absent. Certain medication can also cause you erectile dysfunction. Prostate cancer can also cause you that, and also certain illnesses can also cause you erectile dysfunction. So it not necessarily mean cancer, but this symptom can also be caused by non-cancer condition like a large prostate can also cause that too. Certain medication can also cause that. So how is it detected? How do we detect prostate cancer? Doctor may use this PSA blood test, prostate specific antigen PSA, or digital rectal exam Yeah, but in order to confirm that it is actually a cancer, they have to do prostate biopsy. Okay, so treatment option. We are saying that treatment depends on the stage and how fast the cancer is growing. It's why screening can never be overemphasized. Okay, so treatment depends on the stage and how fast the cancer is growing. Active surveillance is watching slow growing cancer. Yeah, it can be actively watched to see how fast the cancer is growing. Surgery such as prostate removal can also be done. Radiation therapy. If you are going for radiation therapy, it is serious. Hormonal therapy. Okay. And chemotherapy in advanced stage. So once you're on chemo for prostate cancer, no, it is no longer fun. Okay. Targeted or immunotherapies, in some cases, you can be also placed on that. So, but the key takeaway here is this. The key takeaway here is prostate cancer is common, especially with age, and is often highly treatable when caught early. Okay, so we're still going to be talking about this again in the evening because most of our fans are probably at work, and yeah, so we're going to visit this again. Okay, but let's talk about importance of screening. Screening, how important it is. Screening is not one size fits all. Screening can save life. It can also lead to overdiagnosis and unnecessary treatment in some men. But that's why shared decision making is what is key. So key takeaway here will be 50 years plus average rich men. 45 years is higher risk men, one close relative. 40 very high risk men. Multiple relative, and genetic risk. Okay, so let's talk about early diagnosis and signs. Early warning sign. What are the early warning signs of prostate cancer? Totally, it is really smart to ask because prostate cancer can often start silently. It can often side. It can often side. Start silently. And thank you so much, Sonex. I really appreciate you coming on board to watch. I really appreciate you. Okay, Sonex, I really appreciate you. Thanks so much for joining this live broadcast, and thank you for Sonex. Thanks so much, man. Thanks so much. I say amen to that, man. I say amen to that. So I'm talking about a prostate cancer. For you just joining, I'm talking about prostate cancer, and I'm also talking about the early warning sign of prostate cancer, signs and symptoms of prostate cancer. We started earlier, so it's almost like 30 minutes we'll be into this broadcast. So for you just joining, we're going to come back again on board, okay? We're going to come back again on board to we'll come back again on board to repeat this in the evening because most of our fans are probably at work. Okay, so we're saying that early warning sign of prostate cancer in the early stage, symptoms may be mild or mistakenly for normal aging or prostate enlargement. Yeah, because with age, people would think that it is just a prostate enlargement, mostly if you're having some of the symptoms that we mentioned earlier. Okay, urinary change, most common early clue. This is very common. Urinary changes, most common is early clue. Okay, you you may notice frequent urination, especially at night, difficulty starting urinations. Okay, these are some of the most common early clue. It's a very, very common early clue, but we tend to overlook this stuff. Difficulty starting urination, weak or slow urine stream. When you pee, your pee is not that forceful. When you urinate, it's not that forceful. So those are some of the early clue. You feeling like the bladder does not fully empty when you urinate, you still have the urge to go and pee some more. It's an early warning. Pain or burning while urinating is less common. Okay, this symptom can also come from BP, prostate enlargement, BPH, because these symptoms can also come from BPH, which is common with prostate, begin prostate enlargement, BPH. Not always cancer. Okay, it's not every time you have difficulty urinating, frequent urination. No, sometimes prostate cancer um, prostate cancer can also have some of these symptoms, but they should be checked. You should be checked. The bottom line is you need to go for screening because all we are doing here is create awareness. Okay, all what we are doing here is to create healthcare awareness. We're not diagnosing anything. Okay, we're not diagnosing anything. We're just giving you a simple help tip that will help you. That will help you prevent uh, these illnesses because we strongly believe that prevention is better than cure. Okay, you having a blood in your urine or semen, these are pink or reddish urine. These are some of the early clue prostate cancer. Blood in semen after ejaculation. You need to check yourself out. Okay. Rectal or sexual problem. Early prostate cancer can sometimes cause difficulty getting or maintaining an erection. And do not forget, we also say that some certain medication can also cause that too. Okay, but like I said, we are not diagnosing anybody here. What we are just saying is why we are giving you a simple help tip, and we're encouraging you to go for your medical checkup. Okay, so difficulty getting or maintaining erection, painful ejaculation. This might be an early clue of prostate cancer. Reduced sexual function might also be an early clue of prostate cancer. Pelvic or lower back discomfort when it is spread. Some men feel pressure or discomfort in their pelvics because don't forget that prostate is just below the bladder. Okay, so pressure or discomfort in the pelvic might be an early clue. Dull pain in the lower back, hip, or upper thigh. Okay, these are clue. These are clue. This is more concerning if if it's persisted. Okay, if dull pain in the lower back, hip, or upper thigh, pressure or discomfort in your pelvic area. If this pain persists, then it should be of concern to you. Okay, it should be of concern. So, uh, on unexplained weight loss or fatigue, those are later warning. The later warning sign. Not usually an early symptom, but can occur if cancer progresses. Important note: many elderly, many early prostate cancer cause no symptom at all. We said that before. That's why screening is what is key. Screening is key. When to get checked, see a doctor if you are over 50 or over 45 with a higher risk. You have a genetic factor. If you're over 45, you should see a medical doctor for screening. Have a urinary symptom that does not improve, you need to see a medical doctor. Have a family history of prostate cancer, you need to see a medical doctor ASAP. Uh, African or Caribbean ancestry, those are higher risk with more aggressive form of cancer. So you need to see a medical doctor ASAP. Doctor may recommend PSA, prostate antigen. Okay, digital rectum exam also be recommended. Urgent sign, don't ignore. Okay, this urgent sign, please do not ignore. Seek medical care ASAP if you have blood in your urine, you have severe bone pain, sudden inability to urinate. These are urgent signs. You better seek medical help immediately. But for the sake of you who are just joining, we're going to go through it again. Okay, we're going to go through the early prostate cancer sign, and we'll say that early warning sign of prostate cancer. In the early stage, symptoms may be mild or mistakenly for normal aging or prostate enlargement. At the early stage, it might be mistakenly for aging or prostate enlargement. Urinary changes, which is the most common early clue. But do not forget that all urinary changes cannot be attributed to prostate cancer. It might be a prostate enlargement. It might actually be an UTI, urinary tract infection. Okay, but this is why screening do what matters. So early changes, most common early clue. You may notice frequent urination, especially at night. Is an early clue. Difficulty starting urination. This is an early clue. Weak or slow urine stream. Your urine is very, very weak. This is an early clue. Okay, feeling like the bladder does not fully empty. Yeah, this is an early clue. Urinate, you already have the urge to go again. You think you have more to urinate. It's an early clue. Pain or burning while urinating is less common, but it's an early clue too. This symptom can also come from begin prostate enlargement. This is why I said that even UTI can also cause some of these symptoms. Not always cancer, okay, but they should still be checked. Having any of these symptoms, you should be checked. Okay, blood in urine or semen, pink or reddish urine, these are early clue. Blood in semen after ejaculation, these are also some serious um, early warning clue. It is not normally any need. This is not normal and need medical evaluation. Having pink reddish urine, you having blood in your semen after ejaculation. This is not normal and it needs medical evaluation. You're having difficulty with the erection or sexual problems. These are early prostate cancer warning and can sometimes cause difficulty getting or maintaining an erection, painful ejaculation, reduced sexual function. This might be an early warning. Okay, pelvic or lower back discomfort when it is spread. Some men feel pressure or discomfort in their pelvic because don't forget that the prostate is just below the bladder. So if you have pressure or discomfort in your pelvic, dull pain in your lower back, hip, or upper thigh, this is more concerning if it persists. So what you do is try to get a hold of your medical provider and schedule an appointment. Unexplained weight loss or fatigue, later warning. These are late warning, not usually an early symptom, but can occur. if cancer progresses. Important note, many early prostate cancer have no symptom at all. This is why screening is what is key. When to get checked, see a doctor if you're over 50 or over 45 with a higher risk. Have urinary symptom that does not improve. Have a family history of prostate cancer. You need to see a doctor. Africa, you are of Africa or Caribbean descent, you are at higher risk. Africa and Caribbean descent have a higher risk of prostate cancer and the aggressive form. So, doctor may recommend your PSA, blood test, digital rectal exam. Okay, biopsy, like we said, is already recommended to confirm cancer. Urgent sign, don't ignore. Seek medical care ASAP if you have blood in your urine. You have severe bone pain, sudden inability to urinate. You have to see the doctor ASAP. Okay? So for Sonics, I will want to review because I know you joined late because I can see that you came in late on board. But let me reiterate what we'll be preaching here. It's all about prevention because we strongly believe that prevention is what better than cure. So only creating healthcare awareness. We're not diagnosing anybody. We're just telling you some of the symptoms that you should not ignore. So you will not. This does not intend to treat or diagnose anybody. We're just giving you information that will save your life. Okay, because if detected early, it can be treated. For many, prostate cancer is treatable. Okay, so we're going to stop our broadcast here today. So until we come here way again in the evening, this is Gateway 101, and thank you all for watching. Sonel, say bless. I love you coming aboard to watch this broadcast. Thank you so much, sir.